I have these weird neurological symptoms a year later. They're not debilitating, they're not painful, but they're weird and they're 24/7. Many people have symptoms that are more serious.
After some COVID-19 patients recover from their initial bout with the virus, some find they struggle with post-COVID symptoms for weeks or months afterwards.
I saw a teacher who had recurrent bouts of crushing chest pain mimicking a heart attack. A local business owner who couldn't remember the names of his long-term customers.
Began developing chest pain, shortness of breath, difficulty breathing.
I was an excellent teacher. Now I wouldn't trust my memory or brain function with any child right now.
Now, the Centers for Disease Control and Prevention have released interim guidance for physicians treating those patients. The guidance provides recommendations for physicians seeing patients who may have symptoms ranging from a cough or fatigue to heart palpitations or mental health challenges. The guidance encourages physicians to work with patients and their families and to acknowledge that their illness and recovery may not be simple, but to validate it. And the guidelines acknowledge that there's not a diagnostic test that can definitively diagnose post-COVID conditions at this time. Physicians who have monitored long COVID patients say there is no silver bullet for treatment, particularly because patients might have so many different symptoms. The National Institutes of Health last week announced its first grants for conducting research into long COVID, which could help answer questions such as how long patients may be sick with long COVID or whether certain people are predisposed to post-illness symptoms. The more researchers know about long COVID could also make it easier for patients to find assistance they might need, such as medical care or disability leave. Officials expect that more work could be done in the coming months to standardize information about long COVID that could make identifying and treating it easier.